Hey everybody, my name is Rolando. I'm with Xyrus. This is our patient, Gabriella. For those of you who haven't used the Isolite system, there's a couple things that'll really help in success with your patients and you're comfortable with using the system. The key is effective mouthpiece sizing and mouthpiece placement. So what we're going to show you today is how to size your patient and then how to place that mouthpiece. When you look at sizing and placement, it's a really simple process once you understand what needs to be done. And we're going to measure the inter-incisal opening. So if you would please open, and one finger will give you pediatric, 2 fingers is small, 3 fingers is medium, now 4 fingers is large. If you'll see, I can put right around 3, so that would be a medium for Gabriella. The mouthpieces are individually wrapped. They're one-time use, and if you look at them, they're guaranteed clean. So when you present this to your patient knows this is the first time that this mouthpiece has ever been used. At the top of the actual bag, there's a perforation. What she'll do is she'll open it up. Every mouthpiece is shaped and designed the exact same way. There's a bite block, tongue guard, cheek guard. So after you've taken it out of the bag, we'll go ahead and take the device. And we're going to take the air water syringe and spray a little water in the throat. It makes it easier to put it on. Underneath the device, you'll see there are 2 pins, and then there are 2 holes. These are orientation for the mouthpiece to enable you to put it on. There you go. Now before we place it in the patient, I'm going to ask Gabriella to put a little bit of moisture or lubricant on her lips. You can use water, you can use Vaseline, it doesn't matter. Just makes it easier to place. So before you place the mouthpiece, a couple things to consider, and this will also improve the patient experience and placement of the mouthpiece, are these. For the patients that you suspect or feel or you know are gag sensitive, one way to check that is this. If you open your mouth, take your finger and gently slide it into your patient's cheek, because this is a sensation that your patient is going to feel as you first place the mouthpiece. If your patient can tolerate this, not a problem. They'll be able to use the Isolite, no issues. The key in placement is to, as you open a mouth, stay away from the back of the tongue and also be mindful of staying away from the palate. These are the areas that can elicit a gag response. So now when we place it, it's important to go ahead and put a little moisture on the back of the mouthpiece. Now what we're going to do when we place is this. First of all, you want to hold the actual device very gently, not like a hammer, because what will happen is it'll get in the way as you're placing it. You'll bump into the cheek. Hold it up here so that you have nice clearance on the bottom. You want to actually pinch the cheek guard and gently fold it into the tongue guard. And the motion that you're going to be placing it is from side to side, not front to back. When I place it, I'm going to insert the mouthpiece into her cheek, into the buccal vestibule, and I'm going to gently slide it in, ensuring that I'm keeping away from any of the gag sensitive areas. And what I want to do is I want to place the actual bite block at least to the midline of her mouth so that I clear her cheek. Once I do that, I can let go and I can gently draw this down. Now what you'll see is, if you notice, the tongue guard is buccal to her mandible. As I gently draw this down, it drops lingually and I have her bite. And you want to make sure that your patient is comfortable here. Notice the cheek guard is still outside, so it's not too far down the throat. When your patient is comfortable, then you can then gently tuck the ends of the cheek guard into her cheek. And then the last thing that you want to do is, instead of pushing into the retromolar pad, which could be uncomfortable, just gently scoop the tongue guard from the occlusal surface to the lingual. And there you have it. How does that feel? Now the last piece is you want to take it out the way you've put it in. And being mindful about pushing it down the throat, don't use 2 hands to pop it down. One of the techniques that helps very well and keeps it away from the back of the patient's throat is simply taking the device, tilting it towards the cheek, clearing the tongue, and then simply pulling it straight out of the mouth. There you go.